Hello and welcome to Professional Practice, What MRITs Need to Know, Part 2 of 3. Throughout this presentation, the acronym MRIT will be used for Medical Radiation and Imaging Technologist. This is the collective title for all specialties under the College of Medical Radiation and Imaging Technologists of Ontario. That is, radiographers, diagnostic medical sonographers, nuclear medicine and MRI technologists and radiation therapists. During Part 2 of the presentation, you will be learning about our standards of practice, principles of communication, and the Sexual Abuse Prevention Program. We will start with learning about the CMRITO standards of practice. Standards of practice represent minimum standards for a profession. This is true for all regulated health professions. The standards form the foundation, and then all college policies, bylaws, processes and programs are built on these standards. This includes registration or entry to practice processes, quality assurance programs to ensure continued competence, and the complaints and discipline processes. Standards of practice are fundamental to a regulatory college. In fact, failing to maintain the standards of practice of the profession is an act of professional misconduct under the RHPA. The standards of practice are not only important to college processes, they are also used by MRITs, as our minimum acceptable standards, managers and directors, as they set up policies and procedures and monitor the practice of their employees. Educators use the standards as they develop curriculum for student education and to comply with accreditation standards and, perhaps most importantly, members of the public need these standards to understand what type of care they can expect from MRITs. When you review the standards of practice publication, you will see that it includes the scope of practice statement for the profession, the authorized acts for MRITs and the 8 standards of practice and their related indicators. Where can you find the standards of practice publication? From our main website, www.cmrito.org, under Resources, you can click into the Publications section and find it here. The standards of practice are there to help guide you. Please refer to them often. If you can't find what you are looking for, you are welcome to contact the CMRITO anytime. You will also see that under the standards of practice, registrants are expected to be competent, accountable, and collaborative. Let's explore what that means for a moment. Being competent means to have the necessary knowledge, skills, and judgment to perform a task safely, effectively, and ethically, and to apply that knowledge, skill, and judgment to ensure safe, effective, and ethical outcomes for the patient. This means that registrants must maintain competence in their current area of practice, must refrain from acting if not competent, and must take appropriate action to address each situation. Accountability means to take responsibility for decisions and actions, whether they were undertaken on your own, or as part of a team. Registrants must accept the consequences of their decisions and actions. They must use their clinical judgment in the best interests of the patient. Registrants must take appropriate action if they feel these interests are being unnecessarily or unacceptably compromised. This includes not doing ordered procedures or treatment plans that appear to be contraindicated, and if this occurs, taking appropriate action to address the situation. Being collaborative means to work with other members of the healthcare team to achieve the best possible outcomes for the patient. Registrants are responsible for communicating and coordinating the provision of care with other members of the healthcare team and taking appropriate action to address gaps and differences in judgment about care provision. Let's now take a closer look at each of the standards. CMRITO registrants have 8 standards of practice. Each standard has a number of indicators, or qualifiers, that help define the standard. Take some time to become familiar with the indicators as they set the minimum requirements for your practice. You are accountable to uphold every one of them if they apply to your practice. Now we will take a broad look at each of these standards. Please open a copy of the standards of practice and follow along. Practice Standard 1, Legislation, Standards and Ethics is a long but comprehensive practice standard. It explains how registrants must understand and adhere to all of the pertinent legislation, standards of practice, code of ethics and bylaws that apply to the CMRITO and the practice of the profession. Links to all CMRITO publications and the bylaws can be found on the CMRITO website, as shown before. Standard number 2 covers equipment and materials. Registrants must have the knowledge, skills and judgment to select the appropriate equipment and materials for the ordered procedure, determine if the quality, serviceability and operability of the equipment and materials is acceptable and take corrective action where necessary, and make safe and effective use of resources to produce the desired exam information or deliver the ordered treatment. Practice standard number 3 deals with diagnostic and therapeutic procedures. Registrants must be able to administer ionizing radiation, radiopharmaceuticals, sound waves and electromagnetism accurately only when and as ordered. Create clear and accurate images and data for the ordered procedure. Use only the minimum amount of radiation, acoustic power and exposure time necessary. This is also known as ALARA. Evaluate images, data and tests to ensure they are satisfactory. MRITs must have and maintain the knowledge, skills and judgment to practice safely. This is practice standard number 4. This means registrants must adhere to all provincial and federal legislation and guidelines, departmental protocols and policies, and manufacturers' directions. It also means that registrants must monitor their patients and handle or assist in the management of unexpected problems or emergencies. Practice standard number 5 relates to relationships with patients. All CMRITO registrants must ensure that they maintain clear and professional boundaries in relationships with patients. You will learn more about this towards the end of this presentation. MRITs must also treat all patients with dignity and respect, and avoid placing patients at unnecessary risk of harm, pain or distress. We must also provide appropriate responses to patient inquiries, respect a patient's right to consent to, or to refuse treatment, and preserve the confidentiality of professionally acquired information. Practice standard number 6 relates to relationships with other professionals and coworkers. Registrants must be able to practice effectively within interprofessional care teams to achieve the best possible outcomes for the patient. MRITs may accept the delegation of a controlled act from a physician or other health professional with delegating authority, provided they comply with legislation and standards. However, they cannot delegate controlled acts to others. Standard number 7, records and reporting, relates to registrants creating accurate, complete, legible and timely records, charts, incident and other reports that attest to the diagnostic, treatment, quality assurance, workplace, and patient safety procedures that have been carried out. This applies to recording information that will adequately identify the subjects of all the images and data they create, and treatments they administer. Finally, we have practice standard number 8, continuing competence. MRITs must have, maintain and apply the necessary knowledge, skills and judgment to ensure safe, effective and ethical outcomes for the patient. They must maintain competence in their current area of practice, and refrain from acting if not competent. They must obtain and maintain the necessary knowledge, skills and judgment to respond to changes in practice environments, advances in technology, and other emerging issues. All registrants must also participate in the college's quality assurance program as part of maintaining and improving their competence. Many indicators throughout the standards of practice relate to principles of communication. Communication is also stressed in the Code of Ethics. Let's review some of the key principles of communication. As MRITs, our roles involve providing services to patients, often during challenging and emotional times. Effective communication is essential to providing safe and ethical outcomes for patients, but it is also crucial to our interactions with coworkers, interprofessional teams, and with the patient's family and caregivers. Although communication is covered both in our standards of practice and in our Code of Ethics, the principles of effective communication are so important that CMRITO has developed a communication guide. Please see the CMRITO publication called What You Must Know About Communicating with Patients. All 3 publications are available on our website under Resources and Publications. Please take time to review them all. In part 1 of this series, we talked about professional attitudes, identities and behaviors being linked to our personal beliefs, self-perceptions and self-awareness. Remember, our attitude and preconceived beliefs about each patient may have profound effects on our interaction with them. How we identify with a patient must include who they are as a person, not just their illness, injury, or body part. Don't forget that the liver you are scanning is attached to a whole person. Our professional behavior towards a patient must always be based on respect and compassion. Effective communication focuses on clear, respectful, and patient-centered approaches. Respecting the patient's preferences, values, and goals, and involving them in decision-making, where possible, will make their voices heard. Let's review some of the key principles of communication. Active listening. This is the use of body language, your tone of voice, and word choices, to help a patient feel heard and understood. Demonstrate engagement in the conversation by using nonverbal cues like eye contact, open posture, verbal cues, like nodding and paraphrasing what the patient says, and making sure to listen to the patient's nonverbal cues as well. Empathy is important in our communication, not only with patients, but also with coworkers and those who may accompany our patients. Showing compassion and empathy displays a respect for our patients and improves their overall experience. We do this by acknowledging and validating their feelings, concerns, and past experiences. Professionalism was covered in the first part of this series, but it is worth noting that effective communication involves ensuring that professional boundaries are maintained at all times. Make sure you always explain what you are doing and why, especially before touching a patient. And ensure that you have the patient's consent to proceed. Using clear and accessible language means that you explain procedures using specific instructions, you avoid the use of jargon, and you use language or terminology that your patient understands. If you have access to tools that make this easier for your patient, such as translators or accessibility tools, please use them. Acknowledging and addressing the patient's language, cultural, and communication needs can help the patient feel heard and can greatly improve your interaction. Finally, use de-escalation techniques if the interaction begins to take a negative turn. Having self-awareness is key to offering compassion to others. In other words, you can't have compassion for others if you don't have it for yourself. Ask yourself, how are you doing right now? Are you anxious? Tired? Angry? Do you need support? What about your patient? How would you feel in their place? Be aware of how your words, tone of voice, or actions may affect the patient and/or their caregiver. Reflect upon your interactions and adjust if needed. Could your interaction with this patient be improved? Is it being influenced by something you have previously experienced? Your own anxieties or fears? It is always important to remain friendly, but professional, and ensure your actions are compassionate and appropriate for the situation. Let's talk about the patient experience. The patient experience often begins with an introduction. Greet your patient and/or their caregiver in a welcoming manner, with eye contact and a positive attitude. Introduce yourself to your patient, tell them your profession and what procedure you are going to do. This is known as the nod, where you provide your name, your occupation, and what you are doing. Ask your patient how they wish to be addressed. In the coming slides, we will review a scenario together. Our scenario has Marcus, MRTR, coming to work a little frazzled. He is running late, he missed his morning coffee, and is already behind schedule for the day. The next patient is a young boy, Johnny, who fell in the schoolyard. He is in pain and holding his wrist. He is with his mom in the busy waiting room, and he looks like he really does not want to be there. Marcus calls for the patient and asks the mother to stay in the waiting room because it will only be a minute. Johnny is very reluctant to leave his mother and starts to have a fit in the waiting room. He can be heard crying in the X-ray room and won't sit still for the procedure, or cooperate with Marcus at all. How could this negative experience have been prevented? Using some of the introductory tips we just learned, Marcus could have called the patient into the private interview area, greeted the family with a smile and a welcoming manner. After verifying the name he prefers to use, Marcus could have said,
"Hi Johnny, my name is Marcus. I'm a radiographer and I'll be taking an X-ray of your wrist today. The whole procedure will take about 15 minutes because I will need to take pictures of your wrist from different angles. Do you think you could come with me and do this on your own, or would you like your mother to join you?"
After you have introduced yourself, prepare for the procedure. Wherever possible, ask your patient first if they would like their caregiver involved. In our scenario, Marcus realized that Johnny could likely complete this procedure on his own, which may save some time. But knowing that he was upset and scared, he offered Johnny the option to have his mom come with him for the procedure. Giving him the choice up front could have prevented some of his anxieties and reluctant behavior by giving him a little bit of control of the situation. Where appropriate, encourage your patient and any accompanying person to participate in the procedure. For example, helping to change, transferring to the table, providing moral support. Of course, this isn't always possible. If it's not possible, simply explain why. Show a respectful and caring attitude towards your patient by listening to and respecting their perspectives and choices. During the procedure, don't forget to speak directly to your patient, use appropriate eye contact, and be at the same physical level, if possible. Provide your patient with timely, complete and accurate information about the procedure, such as what to expect, and how long you expect the procedure to take. If you have to touch the patient, explain to them why, where, and get their consent. Use language and terminology that your patient can understand, and check in to make sure that your patient understands. Support your patient's autonomy by respecting their decision to change their mind, pause, or stop the procedure at any time. For Johnny and Marcus, it may mean that Marcus has to use simpler words, or find a common analogy so that Johnny understands what he is being asked to do. The exam may take a little longer than usual, but ensuring the patient is compliant will go a long way to ensure he has a good experience and gets the best possible images with the least chance of repeat imaging required. As mentioned earlier, be sure to actively listen to your patient in order to be aware of their concerns or anxieties and respond appropriately throughout the procedure. Has Johnny had a bad experience before? Is he afraid of the big X-ray machine? Is there something that will help alleviate these concerns? Observe your patient for changes in facial expressions and body language. Remember, not all patients verbalize their concerns when they are anxious or upset. Maintain your patient's dignity and keep your patient as comfortable as possible throughout the procedure. This is especially important if they need to disrobe for any part of the procedure. Give the patient updates and give them positive instructions and feedback. Say things like, "Please keep still," rather than, "Don't move." Encourage them with positivity such as, "Great job, just one more picture." After the procedure, be sure to thank your patient and their caregiver. Tell them the next steps, and ask if there is anything else you can do for them. At the end of the day, there were many ways Marcus could have turned Johnny's experience into a positive one. It is always possible to be kind and compassionate. If you have any questions after viewing this section on sexual abuse prevention, please contact the college. Sexual abuse of patients is prohibited under the RHPA. Under the RHPA, any sexual behavior with respect to the patient is sexual abuse. Registrants are required to report any regulated health professional that they believe has sexually abused a patient. Given the inherent power imbalance in the relationship between a health professional and a patient, it is always the health professional's responsibility to ensure that the patient is protected. Patients are not accountable for preventing their own sexual abuse. A patient can never give true consent to sexual or romantic activity or a relationship in this context. Even consensual relationships are considered sexual abuse under the RHPA. CMRITO has a policy of zero tolerance, and takes any allegation of sexual abuse very seriously. It is CMRITO's responsibility to protect the public from abuse by its registrants. The RHPA requires all regulatory colleges to have guidelines for the prevention of sexual abuse and measures for dealing with sexual abuse of patients when it occurs. Sexual abuse represents an extreme boundary violation and abuse of the power in the MRIT-patient relationship. A clear understanding of boundaries and the limits of the professional relationship are essential in abuse prevention. Sexual abuse of a patient is defined as sexual intercourse or other forms of sexual relations between the registrant and the patient, touching, of a sexual nature, of the patient by the registrant, or behavior or remarks, of a sexual nature, by the registrant towards the patient. It does not include touching, behavior or remarks that are clinically appropriate to the service being provided. However, in these circumstances, in the absence of informed consent, the patient could still perceive these clinically appropriate services as abuse. What is the one-year rule? Legislation currently states that an individual continues to be a registrant's patient for 1 year from the date the registrant-patient relationship is formally terminated. In other words, a sexual relationship between a registrant and a former patient is prohibited for a minimum period of 1 year after discontinuing professional services with a patient. Violating this rule can lead to mandatory registration revocation and public documentation of this on the public register, in the Insights newsletter, and in the college's annual report. As previously mentioned, any sexual relationship with a patient is considered sexual abuse under the RHPA. Because there is no RHPA exception for CMRITO registrants to treat their spouses, MRITs must not treat spouses or romantic partners, unless a very narrow legal exception applies. Treating family or friends is strongly discouraged due to risks to objectivity and professionalism. Personal relationships require extra vigilance. Registrants must maintain clear and professional boundaries, must obtain informed consent, must keep patient information confidential, follow privacy laws, and RHPA sexual abuse provisions, and must uphold the college's standards of practice and code of ethics. As you know, the college's standards of practice and code of ethics outline the expectations of registrants around maintaining appropriate boundaries. Despite a registrant's intention to deliver the best possible care to a family member or friend, their clinical objectivity and other accountabilities may be compromised. Please also remember to comply with facility policies in this regard. We have covered a great deal today, including a review of the CMRITO standards of practice, principles of communication, and the sexual abuse prevention program. In the third and final presentation, we will discuss registration, quality assurance, professional conduct, and accountability. For more information on any of the topics covered in this presentation, please visit our website or contact us with your questions. Thank you for your attention.